Have you ever been there? You're outside with your dog, and you can see they're trying to go to the bathroom, but just nothing's happening. They're straining, they're circling, they look so uncomfortable, and you're just standing there feeling, well, worried. You see them hunch over, maybe they even whimper a little bit, but all they can manage is a tiny, hard pebble, or nothing at all. Gosh, that feeling of helplessness, it's something pretty much every dog owner has felt at some point. It is so stressful to see, right? And it's totally natural for your mind to immediately start racing. Are they in pain? Is something seriously wrong here? Your concern is 100% valid. Okay, let's unpack this together. We are going to break down what's really going on so we can turn that worry into confident action. By the end of this, you're going to have a clear idea of what to do.
So let's start with the absolute fundamentals. What are we actually talking about when we say a dog is constipated?
At its core, it's exactly what it sounds like. Their stool is just too hard, too dry, and it's a real struggle for your dog to pass it. It's usually a temporary thing, but it's definitely not comfortable for them. I love this way of thinking about it. You see, the colon's main job is to absorb water. But if things slow down in there, the stool just sits in the colon for way too long. And the colon, it just keeps doing its job, pulling out more and more water, until what's left is, well, hard, dry, and a real pain to pass. Now, this is a really, really important distinction to make. We have constipation, which, like I said, is typically temporary, but if it goes on for too long, it can turn into something called obstipation. That's a much more severe state where the poop is so compacted, your dog literally can't pass it at all. That is a serious medical issue that needs a vet right away. So why does this uncomfortable traffic jam happen in the first place? Well, the causes are actually all over the map, ranging from something as simple as diet to more complex medical issues. I like to group the causes into three main buckets. First, you've got your diet and lifestyle stuff. Things like not drinking enough water, not enough fiber, or maybe swallowing things they shouldn't, like a piece of bone or even just too much hair when they're grooming. Second, we have physical issues. An enlarged prostate in a male dog can literally press on the colon, or even an old pelvic injury that didn't heal quite right. And third, there are other medical factors, like side effects from medication, the natural slowdown that comes with old age, or even just a lack of good regular exercise. Knowing the why is one thing, but how do you spot the problem early? As their owner, you are the most powerful tool we have. Your observation is everything. So at home, here's what to look for. Straining and straining with nothing to show for it. Producing those hard little pebble-like poops, or hearing them whimper. They might circle endlessly or drag their rear end on the ground. Now, a key sign that people sometimes miss is if they're passing small amounts of liquid. Owners can mistake this for diarrhea, but often it's just liquid squeezing around a hard blockage. And of course, a loss of appetite or vomiting are also major red flags. Okay, here's the crucial timing you need to remember. If your dog hasn't had a proper bowel movement in 48 to 72 hours, that's 2 to 3 days, it's time to call your veterinarian. Don't wait on this, especially if they're showing any of those other signs of discomfort. All right, so you've made the call. I know a vet visit can be a little stressful for you and for your dog, so let's just quickly walk through what's likely going to happen so there are no surprises. It's a really logical process. First, your vet's going to listen to your story. When did they last poop? What did it look like? Any diet changes? Then they'll do a gentle physical exam, feeling their abdomen. To get an even clearer picture of what's going on inside, they might suggest an X-ray to see how bad the blockage is, or maybe some blood work to check for underlying issues like dehydration. From there, you'll build a treatment plan together. Which brings us to the most important part, right? Getting your dog feeling better. There are a few different paths to relief, from simple things you can do at home to more direct medical treatments. For milder cases, your vet may suggest starting with some support at home. This is usually things like upping their water intake, adding a little bit of fiber, like pure canned pumpkin. Dogs love that. And getting them moving with some more walks. But for more stubborn cases, that's when we need to step in with veterinary care. This could mean prescription laxatives like lactulose, a professionally done enema, or maybe medications that actually help get the colon moving again. Now, this is so important, so please listen closely. Never ever give your dog an over-the-counter human enema or laxative. So many of these products have ingredients that are actually toxic to dogs and can cause some really severe problems. Please, just leave this part to your veterinarian. Okay, so once your dog is feeling better, our focus totally shifts. how do we keep this from happening again? A good proactive plan is going to be your best defense. The good news is, prevention is usually all about simple, consistent habits. Make sure they always have fresh water. Feed them a high-quality, balanced diet. Regular exercise is fantastic for keeping everything moving. Keep a close eye on stuff they might be tempted to swallow. And hey, for you folks with long-haired dogs, regular grooming is key to preventing hair from causing a blockage back there. So if there's just one thing you take away from all of this, let it be this: you know your dog best. Simply paying attention to their daily habits, what's normal for them, is the single most effective way to catch any health issue, constipation included, before it becomes a big problem. Seriously, think about it. What's one little thing you can do today? Maybe it's adding an extra 5-minute walk to your evening routine, or just making sure that water bowl's always full to the brim. Those small, consistent actions really do make all the difference in the world. Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.